Good morning. I am Ted Rall, and Robby West is filling in for Manila Chan. You are tuned in to the Ted Manila Information Show, TMI for short, where we always try to bring you way too much information, everything from news to politics to lifestyle to vigilantes, offing CEOs, culture, fad diets, what the kids are up to, the taboo, the occult, anything and everything goes, because we believe you can never have too much information, particularly about Clovis the cat. Well, we're not talking about him today, but
and sometimes weather.
And oh yeah, we should do the weather too. And traffic, weather, news. If you're looking for a straight-laced, button-down news program, this show is probably not for you. The F-bombs are going to fly fast and furious, but we try not to do that in the first 15 minutes because of not the FCC, which is not part of this, but we have other YouTube to worry about. It's stuff you want to hear about, and maybe some stuff you never knew you needed to know about. And we like to laugh along the way because, after all, since we're all going to die, let's have fun and smile and joke about it on our way to the gallows. We are live here every Monday to Friday at 10 a.m. Eastern Time, and we stream anytime, including archived episodes. So you can check us out here on the TMI Show on Rumble and YouTube anytime you'd like. You can also go to my website, rall.com, and find the links to the most recent episodes and old ones as well as my cartoons and essays and other propaganda. So, and my other show, the DMZ America podcast, which I do with Scott Stantis. But anyway, right now we're here to do the TMI Show. Please be sure to like and follow the show and share on social media. You can subscribe on YouTube. You can subscribe on Rumble. On Rumble, you can be either paid or unpaid. All of it helps us out. Please support us. Please support anyone whose work you care about. This is the new media environment. This is how it works. On today's show, we're going to be talking about healthcare horror stories. Joining us at the bottom of the hour will be my old co-host on the Final Countdown, Steve Gill. And I'm looking forward to talking to him and hearing his perspectives from the other side of the political spectrum, from yours truly. I'm
looking forward to that because I'm a righty myself.
Yes.
I'm way to the right. And so it's going to be interesting to see where does Steve fall on this versus me.
Yeah, no, I'm wondering about that too. I mean, I'm wondering, I really seriously could not begin to guess what he's going to have to say about this, whether he's going to be on Team Luigi or not. There's one way to find out. Stay here until 10:30 a.m. Eastern Time, 7:30 on the Pacific, and the how to extrapolate in between. So do all that. We won't talk about Atlantic time up there in the maritime provinces because nobody ever talks about that. Let's get into the news. Oh, I have to change the banner to the appropriate banner for the headline news. Okay, here we go. And Manila Chan, by the way, is still out sick with pneumonia and pleurisy. Apparently they gave her some, it's kind of appropriate too, this conversation.
It ties right into the story.
Yeah, they gave her some wimpy antibiotics, right? They gave her like a Z-Pack. This is pleurisy and pneumonia at the same time. I mean, you need the hardcore antibiotics.
Yeah, but she has no immune system. I mean, she's recovering from cancer surgery. So
yeah.
I mean, this fits the model, though, right?
So she's just been lingering. She's just been lingering, basically not getting worse, not getting better, just feeling like crap every single day. So Manila, hang in there. I hope that she was able to get like Cipro or something like that yesterday. If she did, she's going to start to feel better, really, like right away. I know because respiratory crap is my Achilles heel. I've had pneumonia, probably 8 or 9 times. I had swine flu. I had COVID early on in November, December of 2019. I've had COVID probably 4 times. So bronchitis, I couldn't even count all my life. So I know how I'm going to die, gasping for air. That's in the mail for me. Anyway, so not that I'm whinging about it. It's just the reality. I'm not looking forward to it, but maybe I'll get one of those like suicide things in like Holland or something. Anyway, let's get into the news. In his first comments since Luigi Mangione was charged with second-degree murder on Monday, Manhattan District Attorney Alvin Bragg said he was confident that the 26-year-old would quickly be extradited to New York, where he will be held accountable for gunning down United Healthcare CEO Brian Thompson. We will get the defendant here and bring him to justice through our court proceeding, Bragg told ABC News, saying that Mangione could face additional charges beyond the second-degree murder charges he currently faces. I don't know, double parking or littering or something. As we learn more about motives and other things like that, there may be additional charges, Bragg said. Mangione's attorney, Thomas Dickey, in Pennsylvania, said his client intends to plead not guilty to the charges, claiming there's no evidence linking his client to the crime. Bragg said he was confident Mangione is the person who fired 3 rounds into the torso of Thompson last week, killing the healthcare executive and setting off a firestorm of vitriol online and offline, too, I can say that. Bragg's comments came the first day that the New York City Police Department offered the first forensic evidence actually linking Mangione to the alleged crime. According to Police Commissioner Jessica Tisch, fingerprints from the crime scene have been matched to Mangione. I'm wondering if that's from the water bottle that was left behind and the coffee cup. I was kind of think that he'd be wearing gloves, but anyway. And 3 shell casings recovered following the Midtown shootings were matched to Mangione's 3D printed handgun. Bragg's office said his office has focused on combating so-called ghost guns since the beginning of his tenure as district attorney. A ghost gun is, of course, a gun that doesn't have a serial number. It's something that we're seeing more and more in use, speaking generally. It's also something we've seen people who are younger and younger working on, Bragg said. Bragg has found himself at the center of multiple high-profile cases, including his conviction of former President Donald Trump and recent acquittal of Marine veteran Daniel Penny. With the Mangione case, Bragg faces not only a high-profile prosecution, but also a groundswell of public support for the accused murderer. I have spent time with homicide victims, with survivors of violent crime, Bragg said. That's the centerpiece of our work. And to think that there are others celebrating this conduct is beyond comprehension to me. Alvin, is it really beyond your comprehension? Is it really? I mean, I don't know that Alvin Bragg is really the brightest guy ever in New York City, but I'm not sure he's really that dumb.
I don't know. I mean, here's how I'm looking at it. They're talking about how they're going to be bringing all these charges against Luigi. Personally, I am Team Luigi. Full disclosure, if I had a Luigi hat, I would be wearing it right now.
You can buy
right
one.
There with you. I thought about it. I mean, it's just, I don't know. It's just, they're talking about how they're going to be bringing all these charges against Bragg or against Luigi, right? Well, here's my question. When did the charges against the health insurance companies, when are those going to start coming out? When are they going to start being held accountable for all the people that they have bankrupted, that they have killed, that they have ruined their lives, all the lives they've ruined? When are they going to be held accountable?
Well, that is a damn good question. There's been some, interestingly, some of the progressives like Alexandria Ocasio-Cortez and Elizabeth Warren in Congress have asked questions like that. I could see making the case that you kind of don't want to legitimize murder by having the conversation that you would not otherwise have had after the murder. I get that. But on the other hand, I don't think there's, any kind of way to have the murder, to have that conversation any other time, right? It's kind of like when someone famous dies and they say, oh, well, now's not the time to criticize their life. It's like, well, it's actually the only time, right? Like, right, Jimmy Carter, when he dies, I'm going to have lots of things to say about his presidency that are negative. And people are going to say, it's not the right time. Well, if I tried to do it right now, no one would care. People are going to be talking about it then. That's when you assess someone's life. It's the news peg that puts this in the news. Unfortunately, it's not really news when people are just suffering at the hands of the health insurance industry. That's just
business.
The air.
Yeah, that's business. I mean, this is how we talked about last week. This is one of those issues where the left and the right can reach across the aisle and shake hands. And that's what scares the crap out of the elites. They don't want a redneck from Montana talking to a cartoonist in New York saying, hey, you're not my enemy. I'm not your enemy. It's that bastard in that suit who's screwing us both. Let's go after him. That's what they don't want to have happen.
They like the divide. They do like their divide and conquer, don't they?
They do.
They definitely do. One of the things I liked about studying the French Resistance was that, like, all these factions who didn't agree on anything, they all could agree, like, these Germans have got to go, right? Like, they had monarchists fighting side by side with communists. They had devout Catholics side by side with people who were militantly anti-clerical, because the Nazis had to go. That was the priority. These guys in the suits, they are our Nazis. I've been having that conversation with friends. Like, in World War II, is it wrong to kill an SS officer? No, it's not. And a guy like Brian Thompson was an SS officer, basically. All right, let's move on. President Joe Biden is commuting the sentences of about 1,500 people who were already released from prison, placed on home confinement during the pandemic, and is pardoning 39 Americans convicted of nonviolent crimes. It's the largest single-day act of clemency in modern history. Hashtag not true. Jimmy Carter, as soon as he took office, pardoned all of the draft dodgers from the Vietnam War. That was a lot more than 1,500 people. The commutations announced Thursday are for people who have served out home confinement sentences for at least a year after they were released. Prisons were uniquely bad for spreading the virus, and some inmates were released in part to stop the spread. At one point, 1 out of 5 prisoners had COVID-19. That's insane.
That's wild.
Obviously, there's no air circulation in those places. Biden said that he would be taking more steps in the weeks ahead and would continue to review clemency petitions. According to this article, which is wrong, but the second single day act of clemency was Obama with 330 shortly before leaving office in 2017. If you're President West, I
get assassinated.
Do you? Well, probably President Rall would too. Do you think there would be any? Who, if anyone, would you pardon or commute their sentences?
Oh gosh, John Kiriakou first off, 100%.
I'm with that.
And then what I would do, I would all the nonviolent January 6 people. Yeah, Snowden. I would actually hire Snowden to be my press secretary.
Chelsea.
That's what I would do.
Mm-hmm.
I mean, I would go all the way down that list, and basically, if you're a political prisoner in the United States, you're getting a pardon. And I'm going to invite you to the White House, and I would personally apologize to you on behalf of my nation.
There's a lot of nonviolent offenders who are in jail. I mean, our terms are way too long. And, people are like, you'll hear a sentence like, it was 4 years. 4 years is nothing. Really? 4 years is nothing. No, it's not nothing.
It's almost like we have a for-profit prison system.
Almost as if
it's almost like that. That's so weird.
I would like to see, I don't expect this because Biden hasn't been very good about doing the right thing in many respects. But I would like to see a lot more pardons and commutations, and of course, generally, criminal justice reform. That's also something that left and right could agree on. I think.
Yeah. 100% with you. And
people are redeemable.
One of the things I would do. I mean, if I was the president, I would go through. I would do everything that I would not need Congress to do, and I would just start closing military bases all over the world. And I would put every soldier on the military base. I would put the entire army on the Mexican border. Say, here you go.
I think closing those bases would be a real way to make America safer, for sure. No question. All right, let's keep going. FBI Director Christopher Wray is going to resign before Trump takes office next month. But Trump had already said that he was going to fire him. Wray announced at an internal FBI meeting yesterday that he decided to step aside after weeks of thinking about it. Trump has already nominated Kash Patel, who has called for dramatically limiting the FBI's authority to lead the agency. Speaking at the FBI meeting, Wray said, "I've decided the right thing for the Bureau is for me to serve until the end of the current administration in January and then step down." Trump appointed Wray to lead the FBI after firing his predecessor, James Comey, following the FBI's investigations into alleged contacts between the 2016 Trump campaign and Russia, which, of course, we know didn't happen. When appointing him, Trump said Wray, a Yale Law School graduate, is a man of impeccable credentials. But in recent years, Wray fell out of favor with the president-elect after the FBI assisted with a federal probe into Trump's handling of classified documents, a case that has since been dropped. Trump greeted Wray's resignation news as a great day for America. I don't know if you've heard this, Robby, but it seems that what's really going on here is that Wray's decision means that since he would not be replaced after Trump took over, that Trump is going to have to get Kash Patel, approved through Congress through the regular confirmation process through the U.S. Senate, which it's not really clear that that'll be smooth sailing.
I would expect a fight. I mean, the deep state is going to do whatever it can to defend itself and to put its tentacles around Trump everywhere that it can. Call it the deep state blob, whatever it is you want to call it. They're not going to go without a fight.
No, they're not. And the thing is that people always say like the deep state has become like a term of, it's a conspiracy theory. It's something from the far right. I'm going to be really clear here. The origins of the term actually really go to other countries. In particular, Pakistan is really where this term originated. And it refers to the government that basically stays in power through no matter who wins elections, right? No matter who the prime minister is, no matter who the president is, these deputy assistant undersecretaries of whatever, these tens of thousands, hundreds of thousands of bureaucrats and their bosses. These are the people who, when the president comes into power, they're always there, right? They're Democrat or Republican, they're always there. And the deep state is a real thing. It's not a conspiracy, but the mainstream press has been characterizing it as, it's true that conservative media has adopted the term, but it's a term that actually precedes the American conservatives using it. And it actually was developed by sort of liberal historians and political analysts from other countries like Pakistan. It's not some weird right-wing conspiracy.
Well, it's just like the very term conspiracy theory. The CIA marketed that after Kennedy was assassinated. So just because they say something does not mean that there's not any truth in it. They're just trying to discredit you by not even acknowledging the argument.
That would be correct. All right, let's move on. And we're going fast today. About 6 months ago, Trump was sitting in a courtroom in Lower Manhattan listening to a jury make him the first former president ever convicted of a crime. Today, he will ring, I guess he already did this at 9:30 a.m. local time, the opening bell at the New York Stock Exchange, blocks away from the courthouse, and he's been recognized as Time Magazine's Person of the Year. The honors for the businessman turned politician are a measure of Trump's remarkable comeback from an ostracized former president who refused to accept his election loss to a president-elect who won the White House decisively in November. Sam Jacobs, Time editor-in-chief, announced on the Today Show that Trump was the 2024 Person of the Year. Jacobs said Trump was someone who, for better or for worse, had the most influence on the news in 2024. This is someone who made a historic comeback, who reshaped the American presidency, and who's reordering American politics, Jacobs said. It's hard to argue with the fact that the person who's moving into the Oval Office is the most influential person in news, although the person who wins a presidential election is not routinely always the Person of the Year for Time Magazine. Yeah. Robby, I don't think a lot of people really understand what the person, or sometimes it's like the object of the year or the event of the year. I don't think people really ever understood the Time Magazine. It's not really an honor. It's not really we approve of this person or thing. It's supposed to be about the most influential and important person or thing.
Yeah, I mean, it's just I've kind of say this a little bit delicately because of the our wonderful friends over there on YouTube, but there was a certain Austrian painter that had a very unique mustache who was also Time's Person of the Year.
Yeah, that's
and
true.
So just because you're, just like what you said, just because you are on that cover does not mean it's a ringing endorsement of this person or that person's policies. It just means that person has shaped, for better or for worse, the world events for that year, either politically, economically, or whatever else.
Yeah, I know Osama bin Laden was on the short list for 2001 Person of the Year for Time Magazine, or back then it was probably still Man of the Year at the time before they decided to go with Person.
Now, me personally, I was really hoping they'd have Zelensky on there again, maybe this time wearing his tights behind a piano. That would have been awesome because, I mean, anyone that's able to make hundreds of billions of dollars working from home, I want that secret. Mr. Zelensky, let me know your secrets, because here at the TMI show, we could use that expertise. So please let us know. Let us in on the grift. Kind of show us how it's done.
And that is a grift. Yeah. That's yeah, indeed.
Maybe
okay.
Ted, maybe that's what me and you, we need to do the show in tights. That's what we need to do.
You think
maybe
that's
it's
what it is?
Sparkles.
I mean, I'm wearing a pretty tight shirt. Check it out, right? I mean, pretty tight.
Yeah.
You can almost see my nips. I mean,
well, it's cold here in Montana, so I'm wearing the flannel shirt. I mean, it's freaking cold today. It's not winter yet.
Yeah, you said 18 degrees?
Yeah. Send us up some of that global warming. I want some.
Today's supposed to be relative. Today's 37 degrees here in New York City, going down to 27. That's the coldest it's been in a long time. But that's not really historically that cold for New York City at all.
Gotcha.
Obviously. All right.
That's
so
that's a pleasant spring walk.
It is. It's not too bad. Not too bad at all. All right. So let's move on. Last story here before we get into the horror stories from the healthcare industry. The Consumer Financial Protection Bureau has finalized a rule that would limit overdraft charges at big banks and credit unions. This is a move that the Fed say could help save Americans billions of dollars in junk fees every year. Whether or not this new rule stays in place after Trump takes over is unclear. This rule caps fees that customers get charged when they spend more money than they have in their bank accounts. Federal officials said that big banks would have several options to comply. They can cap their overdraft fees at $5 or set their fees at another amount that covers their costs and losses. Alternatively, they could treat overdrafts as a line of credit and provide similar disclosures, including applicable interest rates. While a lot of banks have moved to reduce their overdraft fees already, some charges still average about $30 per bounce or overdraft, according to a recent survey by Bankrate. The rule would apply to institutions with more than $10 billion in assets. That includes about 150 of the nation's roughly 9,000 banks and credit unions. This takes effect next October. Banking trade groups, of course, predictably opposed this change in regulations. Some in the industry are expecting the Trump administration, which took a friendly approach to banks during his first term, to try to roll it back. Yeah, Robby, I'm genuinely curious. I mean, what you think about this? What do you think Trump will roll it back or not? And I got to say, it always bugs me. I'm very obviously, I'm not in favor of overdraft fees. I mean, I used to be a banker. I know it's total bullshit.
Right. I was about to ask you about that.
Doesn't cost the bank anything. It's not like inconvenient to them. It makes no difference at all. It's just like zeros and ones moving through a computer system, and just an opportunity to ding people. So I think this is a great thing. It annoys the shit out of me when an outgoing administration waits till it's got days left and then decides, okay, yeah, we're going to not actually impose this while we're still around. We're going to hand this off to the next administration. Actually, Trump kind of did this to Biden with the withdrawal from Afghanistan, right? He negotiated it. Then Biden had to decide whether or not to pursue it. Now, I want to be clear here. I was very much in favor of the withdrawal from Afghanistan and Biden's decision to go through with it. Obviously, the execution sucked, but the idea of it was a good one. But it's like this. Obviously, the Biden administration wasn't very serious about doing this. They dragged their feet until after the election that they lost to push this through, and it takes them. But I mean, I'm just wondering, what will Trump do? Do you think with this? I mean, do you think he'll be like? I mean, it will be unpopular if he rolls back this rule. That's why I think he's unlikely, and it's not coming out of his pocket, so he might just let it lie, right?
Well, I mean, it's hard to say, right? Because Trump he's almost like a autistic bipolar toddler. So if populist Trump comes through, and if he listens to his base, if he listens to his people, probably the only group of people in the country that are hated more than the insurance companies are the banks. So anything you can do to screw the banks, that is going to be like a huge rah, rah, rah for Trump. And that'll carry over to Vance in the next presidential election, because they can actually say, middle America, you're hurting, you're getting screwed. I fought the man for you. If he did that, it'd be huge. And if the Biden administration, or Harris, or whatever you want to call it, if they had actually done 10% of the things that the people wanted, I think Trump would have lost. But they didn't. I mean, they are wholly enslaved by the bankers. All Harris had going for was, I will let you kill your babies, and I don't even let the federal government pay for it. If she had come out and said, hey, the banks are screwing you with overdraft fees. The reason why you're getting the fees is because the cost of living is too damn high. The cost of food is too damn high. The cost of rent is too damn high. You're not getting pay raises. And the banks are going to spank you for $35 per charge every time you get overdrafted. I'm going to screw them for you.
Yeah, by the way, there are things, when you were mentioning the rent being too high, there are definitely things that, the Democrats kept saying there was nothing that they could do about that. But there are things that the federal government could do in terms of tax policy, right?
Sure.
They could definitely provide a tax incentive to landlords who reduce their rent below a certain amount. They could increase tax rates on those who overcharge. I mean, they can use the tax code.
Yeah. And to me, that would make sense. And like here in Montana, they actually came through Governor Gianforte. Loved the guy. I mean, he literally slams fake news. I voted for him twice. Love the guy. The reason why I brought that up is that the Montana legislature, Montana has a surplus. It's one of the only states in the union with a surplus in the budget. And they pushed through a tax cut, just like we used to saying, for landlords for their primary residence. I wish they had done that also for the houses that they rent out, because that would have done so much more to help the cost of living here.
So with that, let's get into our next topic. We don't have our guest yet, though, which is a little bit annoying. We normally go over, and so we have 2 minutes before Steve Gill joins us, but that's okay.
Well, I actually have a question for you if you have time.
Please, let's do it. We got time.
What has the reaction been with the acquittal of that Penny fella who did the chokehold on that dude in the subway? What's the temperature? Yeah, what's the temperature there in New York? Have you heard anything over there?
Yeah, I mean, basically, it seems it's not like a racially tinged thing. Obviously, there's some people, including people of color, who are unhappy with the verdict. But I think the general feeling in New York was that the witnesses who were in the subway car, who were all experienced veteran subway riders, and said that they were scared to death by the actions of Jordan Neely. Jordan Neely came into it's very important to paint the picture here. He enters a locked subway car. It's traveling between stations. Doors are closed. There's no way to summon the police. Your cell phone doesn't work to call 911 between stations. There's no panic button. And some subway lines have doors that open to the next car, but not the one where this happened. So people are locked in here with this guy. He was running around, yelling, spittle flying out of his mouth, right up in people's faces. And he screamed, "Someone's going to die. I don't care if I go back to jail. I don't care if I go back to Rikers." That's absolutely bone chilling. As someone who's ridden the New York City subway pretty much daily, most of my life since 1981, I can tell you it's unusual not to see crazy homeless people in the subways on your ride. You will see it. But that level of aggression is really unusual. You just don't normally see it. And so that sounds terrifying. And I think the vibe was probably what happened here. Daniel Penny choked him for 6 minutes, ironically using a chokehold that is now prohibited by the NYPD. So as a civilian, he walked for doing something that a cop could go to jail for. Very strange. But I think the general feeling is he should have let him go before he died. I mean, 6 minutes was too long. You should have let him go after 3 minutes. But I think there's also sort of a sense that, we're going to respect and I think the jury and New Yorkers by extension tended to respect what the eyewitnesses said. bear in mind, all of these 20 witnesses, the other passengers on the train, they were all prosecution witnesses. And for Alvin Bragg, they all basically said, I was scared to death of this guy.
Gotcha.
If I was a juror, I would have strongly questioned why, when the train stopped at a station and the doors opened, at that point, why did he not get out of the release Mr. Neely and then run for the door, as everybody should have? I mean, I do have a personal story. Back in 1984, it was, or 1984, in the winter of '84, I was riding a downtown C train in the winter, and and a guy came up to me and pulled a knife and tried to mug me. I was scared to death. Fortunately, there was without getting into all the details, he was bigger than me. I'm 6'2". This guy must have been 6'4". He was a big guy. And fortunately, I was able to get the better of him because the train lurched and I kicked him in the balls as hard as I could. And he went down. The guy smashed the back of his head into the corner of the conductor's booth. And I was wearing steel-toed boots. I was a punk rocker at the time. And I will not lie, I just started kicking him. I wanted him to stay down. And I didn't stop kicking him because I didn't want him to get up. If he got up, I thought I was going to die. I just did that. But I will say, when the train pulled into 59th Street Station at Columbus Circle, as soon as those doors opened up, and by this point, my right eye had been split open. I still don't really see that well out of it. I was on all, covered with blood, dripping all over, on all fours, hands and knees. But I got off that train. Because I was like, the door's open. That's my way out. I'm not staying.
Right.
And I just wonder why that, obviously. And I also am not a huge fan of the fact that Daniel Penny referred to the victim as a crackhead. That seems like, the reaction I would have liked to have seen would have been something more along the lines of, like, I can't believe it. I didn't want him I was scared. I didn't want to kill him. I can't believe he's dead. But instead he's very glib about it. Right. But I think the bottom line is, this is the way our system is supposed to work. Was there reasonable doubt? Yes, there was reasonable doubt. If there's reasonable doubt, you have to let the defendant walk. I think in the end, that's what the jurors did. I think that's probably what anybody would have done.
I mean, back when I was a teenager, I grew up in the South. We used to, if you have disagreements with somebody in the schoolyard, you just go out and you just settle it, And the last real fight I ever got into was before we moved up here to Montana, and it was not long after my wife and I got married. And this dude came up. Back home, it's very unpopular for a white guy to be with a black woman, and in this case, it was a black dude who was really pissed off with the fact that there's a sister with me. And long story short, we got into a fight. And I can just tell you, it was, the adrenaline starts going. You lose all sense of time. And in Penny's case, I have to wonder, did his military training kick in? Because if you're trained to be a sheepdog, you're going to act like a sheepdog. And I just wonder if that played into it.
That's possible. And I see Steve there waiting for us. Steve, as we see you, we're going to bring you in a minute. I'm just going to answer that. I want to allude to that. There's a guy named Robert Grossman. He wrote a book called On Killing. Fascinating book. He's a former member, an officer in the U.S. Army. And basically he talks about like how the Army trains and other branches of the military and around the world train soldiers. And he indicated that during World War II, someone at what was then the War Department assessed that most ammunition was fired over the head of the enemy. It was not fired at the enemy. And of course, the Defense Department viewed that as a waste, and they wanted to train soldiers to fire at the enemy. It's something that they changed the training in between the Korean and the Vietnam Wars to do that. And the numbers flipped. By the Vietnam War, 90% of ammo was fired at the enemy. And the way they did that is basically like you've seen the training range, right, where the figures pop up. Don't think, shoot. Don't think, shoot. Now, up until World War II, they did think before shooting. And it's like there was an assessment, like this person could hurt me, this person could hurt my comrade, so I'm going to shoot them. And World War II veterans most of them did not come back insane. But at the end of the Vietnam War, we had a lot of veterans who never got to process on the battlefield what they were doing before they did it. They processed it afterwards, and maybe some of them were spinning out and never were able to process it. And there's a lot, and Grossman argues that that's not proper. It would be better to go back to the old training ways where the soldier is not like an automaton. The
Right.
soldier thinks about, what they're doing first. I think with Danny Penny, it's entirely possible that you're right. He's just locked up. He basically is like threat, kill, done.
Yep.
And like, maybe he's going to be processing this the rest of his life. I mean, I hope not, but I really can see that.
I mean, it's hard to say, and I know that Steve's coming in. I'll just say this real quick, but one of the reasons why the military, they still train with bayonets, especially in the Marine Corps. When you train to fight with a bayonet or a knife, it reinforces that aggressive tendency in that person. That's why they do it. It's a psychological tool.
All right, let's bring in Steve Gill. Steve Gill, thank you for joining us here on the TMI Show. It's like old times. It's like Steve is my former co-host on my old show, The Final Countdown.
By the way, on the last points, I wonder how the next generation of young warfighters who are training from 12 or younger until they go into the military on Call of Duty, and the point and shoot kind of mindset that puts in place. Now, again, you can't put the reset button when you get shot and killed like you do on Call of Duty. But I know that in the military, they're finding that people are coming in with no previous weapon skills who have great capacity to point, shoot, and use weapons, even though they never touched any of these weapons because they've literally learned on Call of Duty and these other first-person shooter games. So what does that do to a mindset of point, shoot, kill rather than point, think, shoot, kill?
Well, there's also, Grossman in this book that's now kind of old, right? I think it's like 20 years old. So I'm sure the training has evolved that much further. But he said that even back then, there was a partnership between a lot of gaming companies and the Pentagon. And the Pentagon was using video games to help train soldiers in this sort of like very quick, don't think a lot about it, just like boom. I mean, obviously you want to distinguish between civilians and adversaries, but still, it's like I worry about how that's processed. I mean, my grandfather was in the French Resistance, and he lived at the bottom of a bottle the rest of his life after World War II, even though he was a hero because he killed people, and it was hard. Killing people, about 98% of people aren't good at it. Psychologically, they're not really built to do it.
No, it's interesting when the first time I embedded in Iraq a couple of times and with military troops, and one of the first times I went through a training session of kind of clearing the room and going through one of the mock towns of kind of how they go through what they do before they go into actual combat, and in this training session, this kind of clearing a house, they were using airsoft guns, but they were using the metal ones that had much more of the feel of real weapons rather than sort of the plastic ones that the kids were using. So I'm going through this room, and there's balloons set up, and there's hostages, and man, I'm popping through there with my airsoft guns, knocking stuff out, killing the balloons, not the hostage, killing the terrorist, and one of the military guys goes, "Man, are you prior military?" It's like, no, I've got teenage boys. We play airsoft in the backyard almost every day. So those training exercises do come in handy sometimes.
Now, my daddy, kind of like with your granddad, similar story. He was a Korean War veteran. He was in the Navy. He was in Seoul when the North Koreans went across the border. Long story short, he was a gunner on a cruiser. He ended up getting up with a bunch of Marines because he got left. And the Marines ended up keeping them because if you grow up shooting squirrels with the 22 in Northwest Florida, shooting a human with M1 Garand is not that much of a stretch. So the Marines actually ended up keeping them. So that's, to your point, that haunted him for the rest of his life. But he was very good at what he did, but it broke him mentally.
I think that happens a lot. So anyway, speaking of things that could break someone mentally, or maybe in this case may have been broken earlier. So the suspect, who appears to be probably the shooter, right? Luigi Mangione, 26 years old, has been arrested in Pennsylvania, in Altoona. He's awaiting extradition to New York City to face charges by Alvin Bragg, our very famous DA here. He's going to be charged with the shooting of Brian Thompson, who was the CEO, 50 years old, of United Healthcare. And obviously, I think it's fair to say that no high-profile death or murder in the United States in recent memory has been greeted with so much glee, jokes, happiness, positivity than this.
That's crazy.
You know, depending on your point of view, either it's that's a sick indictment of our society and its coldness and callousness to a loss of life, or it's a reflection of the incredible hatred and frustration Americans from left to right have with the health insurance system, or maybe it's both, or maybe it's something else entirely. Steve, what's your take? And then we can get into the legalities.
You know, I think it was not surprising at the outset that, you know, the speculation immediately was that this had something to do with a denial of claims. And this is even before they found the bullet cartridges and those sort of things. You know, I was telling people immediately that this hit had all the appearances of somebody that had a real problem with the insurance company, that it wasn't, you know, some, you know, spousal issue or just some random act. And I think that's been borne out. I think the interesting thing is what turned this guy. And again, was it the medical condition? Was it, you know, something that changed his mental state after he suffered from both the surgery and the medicines? You know, when you've got all these medicines that he would have been on, the contraindications, if you take this and it does something literally to your brain in a way that would convert this kid from, by all accounts, you know, kind of an outstanding all-American kid, you know, who had the world at his fingertips in terms of wealth and prosperity and prestige. Something happened to change his brain. And again, whether it's the medications that he was on, whether it was the pain that he suffered because of his back injury. I think there's a lot still to be answered here, but I agree with you, Ted. The laughter, the humor, the joy at anybody being gunned down who's simply a corporate CEO. He's not there stamping denial on forms. He's not the one making the decisions. And so much of what happens in the insurance industry is dictated by the rules and regulations that the federal government puts in place. It's no different than what you see, whether it's under Obamacare or anything else. There are limits to coverage. There are limits to what, you know, we can afford as a country. We don't see people getting, really intense surgical procedures when they're 92 years old and they have 4 or 5 complications. We're not spending money to spend the last dime to save every last person. So there are decisions that have to be made, and many of them are economic. And it leaves people, you know, feeling like they're confused and that they're being, you know, disregarded and treated in a contemptible manner. So it's not surprising that there are these sorts of responses from time to time by those who are victimized by the system. What shocks me is those who are simply cheering the assault on a human because they felt like they might have been denied a claim at some point, or the confusion of having to fill out these forms. You know, we've just gone through the Medicare renewal plan where you're getting your supplemental insurances. Yeah, I was telling my insurance, you know, agent lady, how do poor dumb people do this stuff? I'm educated and I don't have a clue, you know, what we're doing. There's all these different options and changes. And do you buy this? Do you buy that? You know, do you get this coverage? You know, it's confusing even on the front end of picking whatever plan you're gonna pick. Not much less when you start getting bills from the hospitals, and, you know, your doctor charges this, and then the radiologist charges this, and then there's another charge for this. And again, the, you know, $20 aspirins that show up on your bill. It is a broken system, but it's still in many ways, and Ted and I may argue about this, what a better system than what we see in other countries. Where in England, yeah, you go to the emergency room and you've got an 18-month wait before you get to see the doctor in the emergency room. It's cheaper there because you're dead before you get the coverage. So there's problems with all the systems.
Well, Steve, you gave me a lot to argue with there. So, I mean, first of all, I'm going to just say it's not like there aren't long waits here in our system. I got to tell you, I mean, more often than not, I mean, one of the reasons that urgent care has become so popular is because, you can actually see someone, on a Sunday, let's say, and you can see someone pretty quickly. It might not be the best doctor, but it's a doctor, and you can do it. If you need to see a specialist, it's hilarious sometimes where it's like my pulmonologist sometimes isn't available for days. And it's kind of like, so if I'm having trouble breathing, do you really think I can wait till next Thursday? Probably not, and if I can wait till next Thursday, I probably don't need to come in and see you. So it's, and certainly, I think I take your point about federal regulations, but when you look at a company, and United Healthcare is the biggest, and they're the most prominent because of the story, but any of these companies, they do make decisions about what percentage of claims they want to approve and which ones they don't. United Healthcare and other companies have actually been accused of using AI bots to deny literally a claim faster than one in a second. Now, I'm sorry, I don't really think that that some bot can carefully consider whether your claim is valid in like 0.8 seconds. And I think, basically people, you're already sick. And when you're sick, it does affect your mental state, even if you just have a cold, right? And so you're sick, you don't need any extra nonsense. And, insurance companies provide you with a lot of extra nonsense. The forms you alluded to,
right.
But the routine denials, like where literally they'll deny you and they know it's a valid claim. According to reports, anywhere between 32 and 38% of in-network claims by United Healthcare, in-network, right? These are their trusted doctors, the doctors that they like, the doctors that they've approved of, that they've checked out, and they reject their claims 1 out of 3. I mean, that's wrong.
There's no question that the system is set up, deny everything, make people challenge so that they eventually get it, or
so
maybe
give
it
up.
gets written down a little bit. And then it's also forced doctors into the game playing of, okay, I'm going to write this code, even though that's not really what I'm doing, in order to maneuver and play the game to get the coverage done. I recently had a health issue involving my heart. So I've been assigned to cardiac rehab to go in and work out, with monitors on 3 times a week for 36 sessions. Interestingly, only about 8% of people who get assigned to cardiac rehab complete all 36 sessions, which is what the insurance companies and the hospitals and the doctors recommend to make sure that you go through all of this process, you get your heart healthier and strengthened. And yet I was just informed yesterday when I was at cardiac rehab that, oh, by the way, we're going to come into a new year. So you're not going to get all of your 36. You're going to have to talk to your insurance company. You're going to be reset under your insurance plan. So starting in January, whatever your deductible is starts over, and these sessions cost $300 a session. So basically it's like I should have had my heart attack earlier, so I could have got my 36 all in before the new year. But it's these kind of things, and then we add in. I mean, Ted, we've talked in the past, and Robby on other shows, that the 3 big problems we have in this country, and I'm going to go beyond just the big insurance, but you got big pharma, you got big food, and you got big military, big defense, and all of those 3 contribute to most of the problems that we have as a society, as a country. Big food creates the problems that big pharma tries to fix, or not fix, put you on medications rather than some of the other options. So, again, we've talked, Ted, in the past, that as a lawyer, one of the biggest problems with our medication cost, and the reason it's cheaper in Canada and other countries, is 25 years from now, after an FDA drug has been approved and has been used, they find a problem with it, even though it was approved, went through all the process, and these companies can still get sued. Whereas in Canada and other countries where you don't have this kind of looming threat of litigation decades later, the drugs are cheaper because they're not having to build in a profit with a relatively short patent period, or the threat of, 30 years later, somebody saying, did you use this particular drug, 30 years ago? Contact Dewey, Cheatham and Howe today, and we'll sue them on your behalf. So they're having to stash cash to deal with litigation that may come 30 years down the road. So we've got a lot of problems in the healthcare process, but people still come here from all over the world because we've got the best procedures, the best processes, and the best doctors in the world, apparently.
If you can afford it.
If you can afford it. because kind of like what how you just talked about the claims. My wife is a coder. So you're talking about the codes. I mean, she is neck deep in it. With my day job, I go through and I build the medical charts. So we're just kind of both in this world. And what most people don't realize is that the insurance adjusters, they have quotas about how many claims they're supposed to deny that are in network. Like it is a quota system about how am I going to screw my paying customers? And to me, I mean, that is sickening. For example, if I work in a hospital here in Montana, if I slip on some ice, which could very well happen, I'm in Montana, it's 18 degrees outside, it's colder than a witch's tit. If I go outside, if I slip and break my arm, then I should, the pre-authorization goes in. If I go see an orthopedic doctor who works at the hospital that I work at, under no circumstance should that claim ever be denied, because I'm already paying for a service that through my employer, I should have it. But that's not how it works. And they just drag this stuff out. And, especially in rural areas where you got to figure, am I going to pay this medical copay, or am I going to buy groceries this month, or am I going to pay my utilities, or am I just going to put up getting sicker and sicker and sicker? Most people are just going to unfortunately, they're going to let their health take a back seat and just keep getting sicker until it gets more and more expensive.
By the way, Robby,
the entire system is corrupt.
Talk about false advertising. Have you noticed that Yellowstone never shows the brutal, harsh winters in Montana? It's always the green fields and beautiful pastures. They never show the harsh winters in Montana on Yellowstone. Funny
story. I met a Californian who came up here because of that show yesterday at Wally World, and me and my family kind of stick out because my wife is the only black woman here in town. So we were talking. Going shopping, and this person came up and said, "Oh, are you visiting here?" I said, "No, we live here." And he heard my accent, said, "Well, where are you from?" Explained it to him. So, how do you live here? It's so cold. I'm going to go back to California. I said, "Please do. Please do. Montana's full. Go back."
Montana's not really full, but okay. All right. Well, we'll go with that. So, guys, we went online here on the show, and we solicited healthcare horror stories. And I just want to play one that an audio of a guy who it's worth listening to. And then I want to hear what your take. This is his personal healthcare horror story. And it's up close and personal at the scene of the shooting. Here we go.
And we're just a product. Here in New York City, I got to wait 6 months just to get a physical from my own doctor. Wow, look at all these nervous executives. 6 months I gotta wait. This is my own doctor. Why? Because it's a volume business. And even then, they didn't catch my PSA level rise for 5
sorry. I mean, I got it. Why is he at the
years?
It's not at the beginning.
That looks
pretty
annoying. Serious, right? Maybe I should have been reading my own numbers.
Here we go. Let me play.
I'm at the site of the shooting of that healthcare insurance executive when he was attending an investors conference. Pretty messed up. But then again, when you think about healthcare and investments, it makes you feel like this is a volume business and we're just a product. Here in New York City, I gotta wait 6 months just to get a physical from my own doctor. Wow, look at all these nervous executives. 6 months I gotta wait. This is my own doctor. Why? Because it's a volume business. And even then, they didn't catch my PSA level rise for 5 years. Look at this graph. That looks pretty serious, right? Maybe I should have been reading my own numbers, but let me repeat. I'm not a doctor. What do I know? That's their job. But how can they do their job when so many patients are forced upon them? So they did nothing about it until it was too late, and they actually had to take out my prostate. And then 3 days before my surgery, my insurance company says, "Hey, we're not covering you. Your doctor's out of network." Who needs this kind of stress 3 days before my surgery? A $250,000 surgery. And this is after a $7,000 MRI, a $68,000 PET scan, and a $12,000 stress test. Let me tell you, I failed that stress test. And these hospitals still need money from people like Ken Langone. They named their hospital after him. The founder of Home Depot. Makes sense. No wonder I feel like such a tool. The insurance companies and the hospitals, they work hand in hand to maximize their profits and minimize our humanity. And these doctors, who are mostly good people, they're kind of stuck in the middle because the insurance companies tell the hospitals you can only have a certain amount of time with each patient. So even though they're doctors, they're still working for the man, just like you and me. I don't think anybody should get shot and die just for doing their job. But by the same token, no patient should die because they can't afford a shot. This is your healthcare system. This is your healthcare system on drugs. I'm at the site of the shooting.
All right. I think that was pretty compelling.
Yes. Ted, I have to say, I've gone through some healthcare issues recently, and I've made the worst mistake I could have done. I started binge watching episodes of House. So now every day I wake up thinking, I've got a little bit of a headache. I think I have a tumor complicated by African sleeping sickness. Do not watch House if you're having any healthcare issues, because you're going to be a hypochondriac thinking about 40 different things you could have every time you stub your toe.
Yeah, Dr. Google will do that to you too. It's like, do I have disease X from the Democratic Republic of the Congo? Sounds like it, maybe. Here's the thing. We have a new president coming in, a new old president, and I'm really curious. Donald Trump is not really shy and retiring about commenting on matters of public interest, yet he's had nothing to say about the shooting of Brian Thompson, allegedly by Luigi Mangione. Luigi Mangione's biggest problem might be like all the women trying to break in to get him and take him away with them. Trump has to be taking note of the fact that Americans are really, really, really pissed at the health insurance industry. Do you think there's any chance that he's a lame duck, basically? He doesn't have to worry about, in a way, he's got remarkable freedom. He's 81 years old. He doesn't owe anything to anyone, right? He can do whatever the hell he wants. Trump's 78, right? But anyway, the point is he's free, right? He could try to fix this in a way that no one since Harry Truman has tried to fix it. Is there any chance that that'll happen?
I think part of the reason that Trump has not commented is that this is the new Trump 2.0. He has not been given, giving these hour, off book, speeches. He's only given a few short comments, 10, 15 minutes, kind of at the max. I think when he did the Fox News Patriot Awards, he only spoke for about 15 minutes. He's tweeting some, but he's not even doing I've got to comment on everything all day, every day. So it's a more restrained and more focused Trump. So I think, part of it is that he's not commenting on everything or going on these kind of expansive, here's what I think we should do about everything. By the same token, I think that between what RFK Jr. is going to be doing with Make America Healthy Again, you will hopefully reduce some of the claims, some of the pressures on our healthcare system. Again, we're putting poison into our foods and then eating it, in massive amounts. The diabetes numbers, the obesity numbers. We are so unhealthy in this country. If we can get healthier and also fix the healthcare system and the health insurance system, I think those all kind of go hand in glove. And it'll be interesting to see how they navigate all of those different pieces, moving forward. And I think, first of all, getting America healthier is going to be a big step in the right direction.
So I have a question, because you mentioned Trump 2.0. The Republicans came in. Trump won, and the Republican Party also won by a pretty resounding mandate, in the last election. Do you think that there would be any action to break up the monopoly? For example, if I'm here in Montana, I guarantee you or Ted to be able to buy cheaper insurance here from Montana than what y'all can in New York or Tennessee. Why is it that the government has these government protected monopolies that by definition, why wouldn't the party that says it is in favor of free market capitalism and small government break up the monopolies that by definition infect the government?
Yeah, this is back, Ted and I, when we were still doing our show together, we're coming up with all these great new business ideas, and the Ted, Robby, and Steve Health Insurance Company, if we could reduce some of the regulations and find a way to do it differently, maybe another opportunity. Look at what you have with these kind of Christian coalitions that have started, where you you basically pool your money and then you contribute to the system, and then it pays your healthcare costs. Those have been able to kind of navigate outside the scope of regular insurance. I don't know how well they're doing. I don't know how well those coverage payouts are taking place. But I think more innovation, more creativity is good, when we're talking about anything virtually.
Sure.
And hopefully they will start to break up some of these monopolies. You've got some states where some of the big health insurance companies are dropping off. Okay, we're not going to do business in that state anymore, which again reduces the coverage, reduces the opportunities that people have to get health insurance. But keep in mind, Robby, insurance is always a gamble. It's a bet.
Sure.
They're betting that you're going to pay a lot of money and not get sick. You're betting that you're going to get sick and it's going to cost you less because you have health insurance than it would if you were just out there naked with no coverage. The same way with car insurance. They're betting you're not going to have a wreck, and you're betting you're going to have a wreck. So again, it's all a gamble and a bet, and they're trying to calculate what's the teeter-totter effect of where do they make money versus losing money on who they're gambling against.
But I'm here in Montana. And I'm here in Montana. I'm just north of the Flat Indian Reservation. I know all about gambling. All right. I mean, that's what we got here. At least if you're going to gamble with insurance, like any kind, the house always wins. That's fine. But you can at least go to the house that's going to give you a free buffet ticket, maybe have a cute waitress blow in your ear and give you a cold Coke instead of just bend you over against the table. I mean, let me pick my treatment.
Well, I mean, I got to say, Steve, I mean, the thing is, like with auto insurance, right? Like that's, I've made claims to my auto insurance company, which is Geico, and they paid. I think that's the difference, right? Like if I go to like Harrah's, and I happen to have that full house, and I win, they give me my chips. The problem with like companies like United Healthcare is, oh yeah, we know you're sick. And technically we lost that bet, but we're going to be like, la, 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 we can't hear you. And they play all sorts of games. Like, for example, they deliberately have when I first moved to New York City from Eastern Long Island, I got a new health insurance company because health insurance in this country is by county under the Affordable Care Act, right? I'm in a different county in New York County in Manhattan. And so I immediately need a new PCP, personal primary care physician. So I go on to the Fidelis website, type in my zip code. I get like a list of like 50 doctors. I call the first one. No, we don't take United. Second one, we never took United. Third one, the doctor died like 6 years ago. Fourth one, the practice no longer exists. No, we no longer carry it. Literally, I went through the entire list of every single physician in Manhattan who was listed on the website. None of them took it. And it turned out that the list hadn't been updated and probably never really was correct, but it hadn't been updated in many years. I mean, it seems to me like, look, I want socialized medicine. I want like to go to a government clinic with like a hammer and sickle outside where everybody, the doctors and the nurses are all working for the government. But until we get that, can we get some basic reforms? Like if a doctor's in network, you got to pay. If the doctor is overprescribing and stuff, that's not your problem. That's between the insurance company and the doctor. And the insurance company wants to kick them out of network, they can do that. If the doctor is listed as in network on the website of the insurance company's got to pay. They got to keep their list up to date. Which they gin up these lists of fake doctors that are network to screw over other doctors who are in their network to say your rates have to be lower because there's so much competition in your area, even though it's fake competition and it's not real. So, I mean, they've got to be reined in.
You've got a lot of doctors that are not accepting Medicare or Medicare Advantage because they slow pay the doctors. So it's like, dude, I got to pay my nurses. I got to pay the light bill. I can't wait 90 days till you pay me when I've got to pay stuff before then. So again, as Robby pointed out, I mean, the whole system needs an overhaul. And again, with Trump having only a one term, he doesn't have a second term looming potentially ahead. He's got a narrow window of opportunity, about 18 months to get stuff done. So he's got to hit the ground running. He's got to do everything he's going to do because everybody's going to focus on midterm elections in about 18 months. They're already focusing on presidential election 4 years from now. So I think he recognizes he has a narrow window. I think the people he's assembling recognize that, and they're going to come in and try to get as much done on all fronts right from the get-go. I had a chance to have dinner with Tom Homan last night, the new border czar, and he made it clear. I mean, they're planning shock and awe from day one to deal with the cartels, to find the 350,000 missing children, to lock down the flood continuing to come across, and again to deal with the fentanyl and the sex trafficking that the cartels are operating in Mexico and bringing into our own country. And he indicated that he believes Trump will declare these cartels to be a terrorist organization, to free up the military to go after them in Mexico and anywhere around the world. And really, again, that shock and awe will begin from day one.
Would the Mexican government, I've got a lot of questions about Tom Homan, would the Mexican government allow the U.S. military into Mexico to assist with that? Or I mean, obviously, we're not going to invade Mexico again.
Well, the problem with Mexico is it is a cartel, corrupt run regime, both financially and politically. And we're starting to see the same thing, no pun intended, bleed over to our side of the border as the cartels are here. And they're going to law enforcement saying, look, accept our money or we're going to kill your whole family. And not surprisingly, some, border sheriffs and police are saying, yeah, I'll take the money. Mexico's not going to willingly say, come clean them out. And it's interesting, you've seen kind of a flip-flop back and forth with the president of Mexico when she's, was suddenly claiming, okay, we're going to, deal with Trump and the tariffs and we're going to stop the flow of illegals. And then apparently the cartel called and said, oh, wait a minute, ma'am, we still own you. So she backed off of that. I'm not sure they'll have much choice because economically, she'll either get destroyed by the cartels or destroyed by the U.S. She doesn't have really good choices.
Let me tell you how President West would handle this, because Ted may be president at the top of the show. Here's how President West would handle this. President West would round up every illegal migrant he could find. He would deport every last damn man, woman, and child of them, every single one. You're gone. And if a country will take them back, you cut off all their foreign aid, you end all remittances, you crush them economically, and then that money, then put that into Medicaid, so that way American people could actually start getting health care. That's America first. Screw the rest of the world. Take care of your own.
It may be close to that. I think one of the things that he made clear last night again at dinner that they're targeting the criminal illegals, those that are creating the violent crimes, the hundreds of thousands that are here that have committed crimes here and abroad. The also hundreds of thousands are kind of next on the target list of those who have been ordered to be deported and have ignored the laws and the deportation orders. They're going to be looking for them next. They're not looking for people who've been here, 20, 25 years that have been operating as good citizens throughout that time. They are going to be looking at the millions that have come in the last 3 or 4 years and booting them out, not the ones who've been here for a long time.
What about the ones who've been here for 3 or 4 years? What about the ones who've been here for 3 or 4 years but haven't committed any crimes, have just worked hard and followed the law?
Well, except for the crime of being here illegally. I think they are going to target those, but I don't think they're going to drag them out of schools and workplaces. I think what they're going to do is focus on, you're not going to get any benefits. You're not going to get any economic assistance. You're not going to get food stamps or anything else like that. And basically, if we find you, and you've just come in the last 3 or 4 years, if we find you after January 21st, you will be deported and you will never, ever, ever, ever be granted the opportunity to come back into the U.S. as a tourist or for a green card. But if you leave on your own, we're going to set up a better system for people to apply to come in legally.
Is there any distinction between asylum applicants who followed who went through the app system, presented themselves to the Border Patrol, and then were admitted, or any distinction between them and what they call the gotaways, or are they all kind of being lumped together into the recent arrival bin?
I think they're going to be lumped together as the Biden bogus asylum claims of, they were given a script of what to say, none of which may actually be true. Some of these people who are claiming asylum because they had to leave such terrorist, horrible places have gone back to their home countries as visitors and guests. I don't think they're really afraid if they've gone through 12 different countries to get here. And I think, again, the focus on those and the bogus claim system that the Biden administration set up is going to be retracted pretty quickly.
Wow. Do you know what kind of powers so let's just say Trump does what you said. I mean, he declares the cartels to be terrorist organizations. Maybe he declares a state of emergency on day one. He said that he would do that. I don't know if he would or not. But how much power legally, how much leeway does Tom Homan and the Trump administration writ large have to conduct mass deportations on this scale? That's question one. Then the political question, what about the optics? Some of this, there's going to be women and children screaming, being loaded onto vans in cities. It's going to be ugly. Some of it's going to be on TV. Will the administration press forward regardless of the heat that they take?
Can I answer this real quick?
Yeah, go ahead.
Let me tell you how I handle these optics, because you're right. I mean, the media is going to play it. Here's how I would do it. Okay, so you got these people here who are here illegally. They broke the law to come here. The way that President West will handle this, and I'm hoping this is how the Trump administration does it, I would then take cameras to the homeless American women and kids living in cars, living under bridges, and say, why are these people worth less than some schmuck who came across the border? Sorry, you take care of your own first.
Well, and why are we putting people up in New York City hotels, 14,000 of them at $392 a night? I did an interview the other day with one of the local stations here in Nashville, and the reporter was pressing, saying, well, it's going to destroy the hospitality industry and the construction industry. Who will pick the vegetables? I said, the 14,000 guys living in Manhattan in hotels aren't picking a lot of vegetables in Manhattan. So those are the first 14,000 that need to be deported immediately back to whatever country they came from. Ted, I think you're right, Ted, that the focus is going to be A, through executive orders, B, through the self-deportation. And keep in mind that President Obama, President Biden have deported millions of people. So the idea that the media is going to go, ape shit crazy over Trump doing the same thing, probably in less numbers, is just part of what the media is doing. But keep in mind, about 70% of Americans want all of them deported. So the media is going to be on the wrong side of that edge. So somewhere between 70% of Americans wanting all of them deported and getting rid of the criminals, the violent ones, the ones that have come in here recently that have really broken the rules. I think it's going to be an easier job.
What's going to happen? And I'll make this the last question and let you go, Steve. And this has been great. Thank you for coming on. I got to ask you, what's going to happen when some people are deported back to their countries of origin, and they're killed by like a cartel, or they were a political dissident in that country, and something happens to them, they're tortured or killed or whatever. Those reports are going to be widely disseminated. As you say, the media doesn't have a lot of sympathy for the Trump administration. They're going to play that up. I mean, there's going to be heat.
Oh, I agree. And again, I think those are going to be the highlighted stories, but the death toll of Americans at the hands of these illegals far outnumbers the one or two that are going to be legitimate asylum seekers from some country where they have been politically oppressed. Most of them are here to get jobs, to get freebies. And again, when you look at what's going on in Europe and other places, they're dealing with it aggressively because they're getting the same pushback from their citizens. And I think that Trump's going to get massive support from those who will understand we've got to do two things. We got to stop the flood coming in. If my pipes burst, I don't start putting up new wallboard and painting. I stop the flow of water first. So we got to stop those that are coming in now. Then you start, extricating those who are violent, those who are serious criminals, those who've lied in order to get into the country, those who've ignored deportation orders. And let's go find those 350,000 kids that the Biden administration has admittedly lost.
Okay, Steve Gill, thank you so much for joining us. So great to see you and talk to you again. Steve Gill is a conservative talk radio host based in Nashville, currently doing TV and radio commentary in the U.S. and internationally. Steve attended the University of Tennessee, where he got an undergraduate degree in history and a JD. He served as Director of Intergovernmental Affairs for the U.S. Trade Representative in the Executive Office of the President under both the Bush and Clinton administrations. So great to see him. It's I'm skeptical that this administration will go as far as they say, because every politician overpromises, underdelivers.
Yep.
But we'll see. I mean, and I'm also wondering, to what extent, liberals will really care. My mom and I have had a conversation when Bush started using drones in places like Pakistan, and I was appalled. I said, people are going to freak out. You're using, killer robot, toy robots to blow people up. And she said, they're not going to care. No one's going to care. These are brown people. No one cares. And I suspect I keep thinking that might be the same thing here.
It's hard to say because I love candidate Trump. President Trump, though, has sold us out so many times. I'm talking as a MAGA conservative, right? 2016, I was his biggest supporter. Now it's just like he's just more of the same. Trump says the right things. The problem is that he is owned by the special interests. He's owned by the people who want to keep wages low. Well, how you keep wages low? You import migrants. Well, then what do? How do you get the right and the left to start fighting each other? It's just like we just now heard. You have people who are like me, like I want to deport every last man and child of them, get them out, and then all of a sudden,
what about the dreamers? Would you do that too? Like people who basically came as luggage 16 years ago. They're 16 years old. They can't speak the language at all. Yep. They're basically American. They're as American as you and me, culturally.
Yep. I mean, I hear what you're saying, but I mean, my whole thing is like, nope, sorry, you're gone. And then what you do is that you start paying Americans an actual wage that is sustainable, because how you talked about how inflation is going to keep going up. It's never going to go back down.
Yeah.
Well, that means you've got to actually start paying people what they are worth, because if you don't, what's going to happen is that the working class people, they're like ground into dirt. And until you start having more Luigis coming out, you're going to start having more and more and more friction. You're going to start having more and more breakdown of society, because people, when they get to where you have to decide, am I going to go to the doctor because I have pneumonia, or am I going to buy dinner, or am I going to buy groceries for the next week? Yeah. That's an unsustainable model. And I hear you.
But Robby, we've talked about, the thing is, we've talked about the birth, the fertility crisis, something Elon Musk has talked about. He's not wrong. He's doing his part. He has 10 kids. Yeah. But we have a fertility crisis in this country. Now, obviously, if I had my druthers, we'd have a communist system and we wouldn't have the following issue. But in the capitalist system that we have that's based on consumerism, the GDP has to increase about 2 to 3% per year in order to just sort of not to avoid a recession or a depression. Right. So the economy has to constantly expand every year. Now, if you have a big leap in technological efficiency, like let's say AI, that'll get you through some of those low birth rates period. The economy will expand regardless of a shrinking population. But most years you don't have that, right? Most years you have the same thing you had last year. And so if you have a fertility rate of 1.7 when you need one of 2.3.
Well, yeah, you fix that, right?
Well, the U.S. is, you can get either get people to have more kids, you can incentivize that, or you import them. Those are the only two ways that you can increase your population, right?
Yeah, I'm all about option number one. What you do is that you ban abortion. Again, I'm a right winger. I'm telling you, I am a right wing Christian. I believe that life begins at the moment of conception. We are a child of God. Abortion is murder. That is my stand. That's all right, but then that's a hill I will die on.
But still, even if you eliminated abortion and had all these unwanted babies, I don't think you're going to get to 2.3 that way, right? I mean, you're still going to need. So I think the system is set. I think it's insane. I think personally it's insane that the system is set up that you need to constantly expand the economy. It's why we're always selling more shit to people that they don't need.
Well, here's my question, and I'm going to show my ignorance here, because I don't have your background. I don't have your education. Why is a recession a bad thing? Why is it that having a lower cost of living, how is that bad? How's the cost of my rent or my utilities going down bad? Sure, it's bad for the shareholders. Screw them. They do nothing for me. It's these bankers who are screwing me. So I don't mind if they take a haircut.
Okay, the real problem. Okay, so the main problem with a recession or a depression is that you end up basically the economy seizes up and you end up with widespread unemployment, right? So, for example, when at the time that FDR became president in 1932, the unemployment rate was 25%. So, basically people couldn't eat. They couldn't, there was no, that's the problem, right? And if you have widespread unemployment, I mean, I don't have to explain why that's bad, right?
Sure, that's very bad. But here's my question, though. It's going to happen anyway, right? I mean, with automation and AI and more and more working class jobs going away, one day that's going to happen regardless.
That's
because
true.
Those jobs are going to disappear. So why not just?
That's already happening quietly.
Of course it is.
There are people who are basically unemployment's already going up, but basically they're not counted because they're not counted as being part of they're not part of the worker participation rate, right? By the people, the statisticians in the federal government. So basically, the number of people who participate in the workforce is dropping. Effectively, they're unemployed. Or they're in the underground economy, right?
Yeah. So then, why do you need a population that's always growing if you're bringing in more people that jobs by definition are not going to be there for? What's the point?
That's a good point. I mean, I personally believe in a universal basic income because the U.S. can afford it and it buys social stability. Pay people to stay at home. Also, if you pay people to stay at home, some of them are going to become entrepreneurs. They're going to be bored. They're going to start their own businesses, open their own stores, start new lines of work. It's going to be better for everybody. But I agree. I think we talked about the perils of attaching healthcare to work, something that was stupid going back to the 1940s. Attaching income to work is no longer relevant because of what you're saying. I mean, if we have robots doing things for us, shouldn't we be happy about that, celebrate it, and change the system accordingly?
Well, I mean, that's the way I look at it. But what the hell do I know? I mean, here in my town, we don't have the traffic problems that you have. The traffic problems, the traffic problems we have are cows blocking the roads because they're being herded and they decide to stop. So it's first world versus third world problems, right? But at the end of the day, though, if you have a consumer model, but the jobs that are making the crap that people buy are being automated out, why then do I need to go bomb the crap out of Nicaragua for whatever reason, import a quarter of their population to come do jobs that, quote, Americans won't do because robots are doing them, or because Americans are not getting paid enough money to afford the crappy health insurance, so that way when they get sick because they're shoveling cow crap in Louisiana, I mean, who the hell would do that? It makes zero sense.
Well, look, I agree with you on that. So, all right, we're gonna have to leave that there because we're running late. Yeah, we did, and that was. I'm glad that Steve talked a little bit about about his meeting with Tom Homan. I'd like to hear more about that at some point.
Me too.
But Tom Homan's a true believer. All right. So anyway, thanks everyone for joining us. Thanks very much to Putinbot Gaming, aka Robby West, guest co-host today and all week long. Thank you for your support. Thanks for moderating the chat. Please go check out Putinbot Gaming, the gaming channel. Please subscribe on Rumble, either paid or unpaid. If you're doing it on the paid, you got to do it while we're still live. So hurry up and do it now. Don't dawdle. Please subscribe on YouTube and follow us.
For less than the price of a cup of coffee, you can help keep the show viable.
And it'll probably keep you at least as awake. If you enjoy what you see, what you find value in what we're doing, please help us continue. So blah, 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 fully independent. And we rely completely on you guys. So subscribe. Oh, please.
Let me say something real quick. One thing I'm gonna let y'all know that we have a library. I'm going to be dropping a lot of the old segments, a lot of the show hits. They've already started hitting now. They're going to be going on YouTube first because I'm trying to build a subscriber base because I want money to be able to pay for my crappy health insurance. And then they'll be going on Rumble a day later. So keep an eye out for those. Okay. All right. And with that, thank you, everyone. Thank you, Robby. We'll see you guys all tomorrow. And thanks again. Bye, thank you, everyone.